Hello everyone. So now we're going to talk about the AMSTAR tool, which is an assessment tool for evaluating the methodological quality of systematic reviews. I hope this lecture can help you on your critical appraisal later on. So as I said before, the AMSTAR tool is a critical appraisal tool for systematic reviews that included either randomized or non-randomized studies in the field of healthcare. So I will go over each one of the 16 questions so you can get a sense on how you should read and, interpret each one of the questions, and then it'll be easier for you on doing your critical appraisal for the systematic review on tolerabilitation. Okay, so in terms of the first question, the AMSTAR tool asks if did the research question and inclusion criteria for the review include the components of PICO. So we have only two options here, yes or no. For yes, we had the review need to report each one of these four PICO elements here. So we need to find the population, the intervention, the comparator group, and also the outcome. If these four components of PICO are very well reported, it's yes. And if one of these four is missing, it should be no, okay? The information regarding the time frame for follow-up is optional. So reporting or not reporting this information will not change this decision here, the final decision between yes or no, okay? Okay, so for the second question, we have, did the report of the review contain an explicit statement that the review methods were established prior to the conduct of the review? And did the report justify any significant deviations from the protocol? So for this question, we have these three options, yes, partial yes, and no. For partial yes, the review's authors need to state that they did have a written protocol or a guide, but they didn't need to be, the protocol or guide doesn't need to be published or registered, okay? But they did have to present these four information here: the review question, search strategy, inclusion and exclusion criteria, and also a risk of bias assessment tool. If we find all these four intervention or information here on the protocol or on the guide, it's partial yes. But if at least one of these information is missing, it's no, okay? For yes, the protocol should be registered or published, and also need to specify these three informations. So a meta-analysis plan or a synthesis plan, if appropriate, a plan for investigating causes of heterogeneity, as you have talked before on the systematic review with meta-analysis lecture, and also they need to justify on the paper, not on the protocol, if they had any deviations from the protocol. So if all these seven information here is found on the protocol and on the manuscript, it's yes, okay? Okay, so the third question is in terms of the selection of the study designs. So did the review authors explain their selection of the study designs for inclusion in the review? This is a tricky question because when I read this statement here, what I understand is that the authors need to explain the reason for including, for example, only RCTs and not RCTs and non-RCTs, for example. I have been doing some reading, and what I have seen is that if the authors of systematic reviews state that they included RCTs only, or they decided to include both RCTs and non-randomized control trials, for example, it's okay, it's fine, and should be yes. But when they don't state in the inclusion criteria what type of study design they are planning to include, so it should be no. The next question is regarding the search strategy. So did the review authors use a comprehensive literature search strategy? We also have yes, partial yes, and no as an option. And for partial yes, the authors need to report that they did conduct a search on at least 2 databases that were relevant to the research question. They also need to report that they provide keywords and or search strategies. And also they need to justify if they conduct any publication restrictions such as language, country, or year of publication. So if all of these three are met, so it's partial yes, and at least one of these three information is missing, it's no. For yes, in addition to these three, they also need to report that they have conducted a search on the reference list of included studies. For example, they ask or consult the content experts in the field, and also they needed to conduct the search within 24 months of completion of the review, for example. So if all of these 5 items are reported on the systematic review, it's yes for this question. The next question is in terms of the selection, the process of the selection of the studies. So did the review authors perform study selections in duplicate? And we only have 2 options, yes and no. If yes, either one of the following should be reported. Should you have reported? So at least 2 reviewers independently agreed on the selection of eligible studies and achieved consensus on which studies to include, or 2 reviewers selected a sample of eligible studies and achieved good agreement, at least 80%. For this agreement here, we usually use the kappa to calculate the agreement level, and with the remainder selected by one reviewer. And it's not clear here, but if they say that a third reviewer was requested to help to solve any disagreements between the 2 first reviewers, it's okay, yes, and it should be yes as well. The question number 6 is very similar to the previous one, but this one is in terms of the dissection. Did the review authors perform dissection in duplicate? So it should be yes if at least 2 reviewers achieve a consensus on which data to extract from included studies. So if both at least 2 reviewers independently extracted the data, it's okay, it's yes. Or when 2 reviewers started extracting the data, but then they realize that they achieve a good agreement between both of them, and then only one review extracted half of the remaining papers, and the other one the other half. So in both cases, it's yes. The question number 7 is in terms of the list of excluded studies. So did the review authors provide a list of excluded studies and justify the exclusion? To be honest, this is not common to see a list of excluded studies. on non-Cochrane reviews. Cochrane reviews must do this because they don't have page limit. So they authors of Cochrane systematic reviews can describe the methods of the reviews in very details, in in-depth details. But for sake of time and for sake of room, it's not common to see this. So for partial yes, authors need to provide a list of all potentially relevant studies and that were read in full text form but excluded from the review. And for yes, they need to justify the exclusion from the review of each potentially relevant study. For example, on the telerehabilitation review, we included, let's say we included only chronic patients, chronic low back pain patients. If we read a paper that match all the other inclusion criteria, but they did include only acute and subacute low back pain patients, the reason of exclusion needs to be there. Like it was excluded. We actually read the full text of this paper, but it was not included because of the population. So the reason should be there. And yes, so for yes, the list and the justification of the exclusion should be there. And for no, which is more common to see when the authors don't even provide us with the list of excluded studies. The question number 8 is regarding the description of included studies. So did the review authors describe the included studies in adequate detail? We also have yes, partial yes, and no. And for partial yes is that when the authors described all the PICO elements, including the research designs that were included. So they described what was the population, the intervention, the comparators, and the outcomes, and also the research design. And this information is not regarding the methods anymore. This is from the results. What was the information from the included studies? Okay, that's the difference between the first question and this question. And for yes, authors should have also described all this information, but in details. And also need to describe the time frame for follow-up. And also the study settings. So yeah, I think this is more feasible and it happens more frequently actually. And of course, as you know, if any of these 5 information is missing, it should be no. The question number 9 is, did the review authors use a satisfactory technique for assessing the risk of bias in individual studies that were included in the review? And here we have 2 options. For RCTs, these are the criteria. And for non-randomized studies, these should be the criteria. So for randomized control trials, for partial yes, authors must have assessed risk of bias from uncausal allocation and lack of blinding of patients and assessors when assessing outcomes for objective outcomes such as all-cause mortality. For yes, in addition of these 2 first criteria, they also need to assess the risk of bias from allocation sequence that was not truly random and selection of the reported results from among multiple measurements or analysis of a specific outcome. So yeah, if these four are met, it should be yes. And if one of these is missing, it should be no. And again, for most of studies in the rehabilitation field, we cannot blind the patients because patients can, they are aware that they are doing an exercise or they are taking, they are taking a educational lecture or section or something like this. So it's really, really hard to get to blind the patients. So most of the market reviews don't get this criteria here. The question number 9 is, did the review authors report on the source of funding for the studies included in the review? And for yes, they must have reported on the sources of funding for each one of the individual studies included in the review. And when the reviewers looked for this information, but they did not find, because in the report that they didn't find, it also qualifies as yes. And of course, it's no when the authors didn't even mention that they tried to find the source of fundings for individual studies, individual included studies. So the question number 11 is, if meta-analysis were performed, did the review authors use appropriate methods for the statistical combination of results? So we talked about meta-analysis on the previous lecture on systematic reviews with meta-analysis. So it's for RCTs, it should be yes when the authors justify combining the data in a meta-analysis. So do you remember when you try to combine the fruits, the orange, apples, and bananas? So we need to find the reporting of how the authors decided to do this combination. If they combine, like, for example, both acute and subacute, also with a chronic population, it's not fine because they should have different results. Acute and subacute, okay, it's okay if you combine them all together, but acute and subacute plus chronic low back pain is not fine at all. And okay, and also if they used an appropriate weighted technique to combine study results and adjusted or for heterogeneity if present, and also if they investigated the cause of any heterogeneity. So for the question number 12 is, if meta-analysis was performed, did the review authors assess the potential impact of risk of bias in individual studies on the results of the meta-analysis or other evidence synthesis? And we have two options for yes. The first one is when authors included only low risk of bias as RCTs. And the other one is when, if the pooled estimate was based on RCTs and on non-randomized studies at variable risk of bias, the authors performed analysis to investigate possible impact of the risk of bias on summary estimates of effect. In summary, for this second option, what authors should do is they need to conduct a meta-analysis with both high and low risk of bias studies and see the results. And then they need to separate the low risk of bias from the high risk of bias studies, and then conduct two meta-analyses separately. And what happened is that usually high risk of bias studies overestimate the effect of the intervention. And when you do this sensitivity analysis, we do a test. We are trying to understand if those high risk of bias studies are actually overestimating the effect of the intervention or not. So if it's done, so the authors mention that, it's yes. And before I jump to the question 13, I need to mention something very important, that not ours, the authors of systematic reviews, are able to perform a sensitivity analysis. And this is not because they don't want to, but rather than that, sometimes the number of included studies doesn't allow them to conduct this sensitivity analysis. But because they included a small number of studies in some comparisons, they cannot separate the low risk of bias studies from the high risk of bias and do two separately meta-analysis. So it's important to mention that. And in terms of the question number 13, it's regarding the interpretation and discussion of the results according to the risk of bias individual studies. So it's the same thinking of the previous question. And for yes, we had two options. The authors included only low risk of bias RCTs, or if they included high or moderate risk of bias RCTs or non-randomized studies, they provided a discussion of the likely impact of the risk of bias on the results. And the 14th question is, did the review authors provide a satisfactory explanation for and discussion of any heterogeneity observed in the results of the review? So for yes, we should have either there was no significant heterogeneity in the results, or if heterogeneity was present, the authors performed an investigation of source of any heterogeneity in the results and discussed the results of this on the results of the review. So the following question is related to the publication bias. So for yes, performed graphical or statistical tests for publication bias and discuss the likelihood and magnitude of the impact of publication bias. So remember that you have talked about publication bias on the systematic reviews lecture. So the funnel plot needs to be done when more than 10 studies are included in each comparison. So again, sometimes authors of systematic reviews plan to do a funnel plot investigation of publication bias, but due to a small sample, a small number of included studies, they are not allowed to. And the last question is in terms of did the review authors report any potential source of conflict of interest, including any funding they received for conducting systematic review? And this is kind of similar to the previous question in terms of funding for included studies, but in this case, it's regarding the authors of the review. So if the authors reported no competing interest, or if the authors described their funding source and how they managed potential conflicts of interest, it should be yes. And if none of this information is reported, it's definitely no. So thank you so much for watching this presentation on how to use the AMSTAR tool for evaluating the methodological quality of systematic reviews. I hope you could learn a little bit more about that, and let me know if you have any questions. So see you soon.